Hello, everyone, and welcome back to One Big Question podcast, presented by ProMed Consultings. We are here to answer one big question in the medical wound care space. Sean, did you know that chronic wounds cost the U.S. healthcare system tens of billions of dollars every year? And yet, the hospital departments treating them are some of the least talked about.
That's wild hope. I mean, when you think about healthcare, you picture ERs, high-tech surgical robots, or even massive cancer centers. Wound care doesn't exactly scream cutting edge.
Exactly. But here's the thing. Hospital wound care departments are quietly becoming some of the most financially and strategically important parts of the healthcare system. They're not flashy, but they're reshaping how hospitals think about revenue and patient care.
So, what's driving this shift? Why are these departments suddenly so important?
It all starts with the sheer scale of the problem. Millions of Americans are dealing with chronic wounds, diabetic ulcers, pressure injuries, surgical complications, burns, you name it. These aren't just minor issues. They're complex, expensive, and often lead to serious complications like amputations if left untreated.
And when you say expensive, we're talking billions, right?
Yes, tens of billions annually. And here's the kicker. Hospitals lose money when these wounds are ignored early on. But when they're treated aggressively and efficiently, they actually generate sustainable revenue. That's a complete shift in how hospitals think about care.
So it's not just about healing wounds. It's about preventing those complications that lead to even bigger costs down the line.
Exactly. And that's where wound care becomes so financially compelling. It's not a one-time treatment. These patients often require ongoing care, weekly visits, advanced therapies like hyperbaric oxygen, surgical interventions, and even home health coordination.
In business terms, that sounds like recurring revenue.
That's exactly what it is. And in a healthcare environment where reimbursement models are constantly changing, having a predictable recurring revenue stream is invaluable.
Let's talk about hyperbaric oxygen therapy for a second. That seems to be a big part of this story.
It really is. Hyperbaric oxygen therapy, or HBOT, involves patients sitting in pressurized chambers and breathing oxygen-rich air. It's designed to accelerate healing, especially for chronic wounds. Financially, it's a goldmine because patients often need dozens of sessions over several weeks.
So, a single patient could represent months of outpatient revenue for a hospital.
Exactly. And that's why hospitals are investing in these programs. It's not just about the therapy itself. It's about the predictable financial performance it brings.
But it's not just about the money, right? There's a real human element here.
Absolutely. Chronic wounds can be devastating for patients. They impact mobility, quality of life, and even mental health. Effective wound care can prevent amputations, reduce hospital readmissions, and improve overall outcomes.
And yet, there's a staffing crisis in wound care.
Yes, and that's a huge challenge. There simply aren't enough certified wound care specialists to meet the demand. As the population ages and diabetes rates rise, the need for skilled professionals is only going to grow.
But for hospitals that do invest in these specialists, the rewards can be significant.
That's right. Hospitals with elite wound care programs attract more physician referrals, insurance partnerships, and even regional patient traffic. It's a competitive advantage in a very challenging healthcare landscape.
And this is especially important for rural hospitals, isn't it?
It is. Rural hospitals are struggling financially. They're dealing with labor expenses, declining reimbursements, and overloaded emergency departments. Wound care offers a lifeline because it brings consistent outpatient traffic without the massive infrastructure costs of, say, a new surgical wing.
So, a strong wound care program could actually help stabilize a rural hospital.
Exactly. It becomes a cornerstone service line that supports the entire healthcare system in that region.
And then there's the technology piece. AI is starting to play a role in wound care, isn't it?
Yes, and it's incredibly exciting. Hospitals are investing in AI wound imaging, predictive healing analytics, remote monitoring, and even smart dressings. Wound care generates a ton of clinical data, which makes it an ideal environment for AI-driven innovation.
So, we're talking about a future where hospitals combine advanced wound care with telehealth and predictive analytics.
Exactly. The hospitals that embrace this kind of innovation could dominate their regional markets over the next decade.
But with all this money flowing into wound care, there's bound to be some ethical concerns, right?
Absolutely. Whenever you have massive financial incentives in medicine, there's a risk of overutilization or prioritizing reimbursement over patient outcomes. The challenge for hospitals will be to balance ethical care with financial sustainability.
So, the most successful systems will be the ones that focus on healing outcomes, not just revenue.
Exactly. The goal should be to reduce amputations, speed up recovery times, and improve quality of life for patients.
And that's why hospital executives are finally paying attention to wound care.
Yes, they're under immense pressure from labor costs, insurance denials, and regulatory demands. They need service lines that generate stable revenue, improve quality metrics, and support outpatient growth. Wound care checks all those boxes.
So, the future of healthcare might not be about building bigger campuses or surgical wings.
Right? The future could be about specialized outpatient ecosystems that focus on prevention, chronic disease management, and long-term patient engagement.
And wound care is right at the center of that transformation.
It is. It's not flashy or glamorous, but it's incredibly powerful.
So, what's the big takeaway here?
The hidden billion-dollar crisis isn't just about wounds, it's about what wounds reveal. They expose deeper issues like America's chronic disease epidemic, staffing shortages, and the fragile economics of hospitals.
And the solution might not be in massive expansions, but in efficient, ethical care for chronic conditions.
Exactly. Hospitals that once viewed wound care as secondary are now treating it like strategic infrastructure. The future of healthcare revenue may very well come from preventing amputations, healing ulcers, and managing diabetic complications.
Not the most glamorous work, but it's work that truly matters.
Absolutely. And it's work that's quietly shaping the future of healthcare as we know it.
Well, that's a lot to think about.
It is, but it's also a hopeful story. One where smart, focused care can make a real difference.
And on that note, let's wrap it up.
Sounds good. Until next time.
Take care.